Today we'll be talking about how to spot malnutrition across your organization and then how to monitor and improve nutrition for patients at risk. Hi, I'm TANYA Vaness, and I do believe food service is medicine. 30% of U.S. hospital patients suffer from malnutrition, most notably the elderly, oncology patients, those with chronic illnesses, patients undergoing surgery, or anyone who's eating 50% or less of their food. So the problem is large, and improvements we can make can have a significant impact on patient outcomes. Decline in nutritional status is associated with prolonged length of stay. Reducing length of stay reduces costs. A prospective cohort study conducted in 18 Canadian hospitals showed treating malnutrition reduced the average length of stay by approximately 2 days. Malnourished patients are hospitalized an average of 2 days longer than those screened and treated early. That is why your nutrition team can make such a difference when you target malnutrition. In smaller hospitals, it may have been possible to monitor patients for malnutrition, but as hospitals grow and health systems expand, you need technology to be able to monitor all of your patients and view actionable information. When you're using Seaboard Nutrition Service Suite or Room Service Choice, you have all the information in your system to easily track patient intake. Mobile Intake takes the meal information for each patient and displays it in a way that makes it easy to track how much of each item a patient has actually eaten. And your system knows the nutritional content of the items you're serving, and so it can make the calculation that allow you to know exactly what is being consumed over a meal period or over days. When you add mobile intake to your operation, you'll be able to go into the card file and designate those who you wish to monitor for malnutrition, or you can monitor everyone. You can turn on Add Monitor Intake, and an icon shows up to help you identify patients you have set to monitor. At the time your host collects the tray, you can bring up a screen that allows them to enter in the percent consumed for every item served. The average time to record a tray is under 30 seconds. You can also collect notes if you want to find out why something is not being eaten. Our mobile intake solution provides reports that support a proactive approach to spotting and treating malnutrition. Dietitians will have the information they need to implement programs to intervene and lower the rates of malnutrition, and they'll be able to track and report on results. Nursing and the care team will have access to nutrition consumed, so they'll really be able to see and understand exactly what each patient has actually eaten and whether they're at risk for malnutrition. Many studies have shown that intervening and caring for malnutrition has a powerful impact on outcomes. With mobile intake, your dietitians will be able to conduct their own studies and show your management team just how important improving intake and patient nutrition can be to improving healthcare. I believe food service is medicine, and with this technology, your team will be able to prove it. I am sure you have questions about it, so send an email asking about mobile intake to thepoint@seaboard.com. Thanks for taking the time today to learn how technology can support you in your efforts to identify and care for patients with malnutrition. This is TANYA Vaness, and this has been To The Point.